hip internal rotation positional isometrics. So if we're doing positional isometrics, or if you're doing positional isometrics, that means you've got hypermobility, and that just means you've got too big a gap between your active and passive range of motion in your hip internal rotation. So what I mean by that is this. We've obviously already discussed this, but just really quickly, with my wrist, I can actively get this far. That's my active range. My passive range is if I stretch, I've got about a 10 or 15 degree gap. That's normal. If you've got more than that, that can create some sort of safety issues for your body because your limb can get somewhere where your joints don't control it. So what positional isometrics is you're going to get into an internal rotation stretch of your hip to the end of your active range, and then you're going to push past it passively, so into a stretch 10 to 15 degrees more. Then you're going to do a rep. Once that rep is done, you're going to move another 10 or 15 degrees. And I'll show you as an example with, you know what, I'll actually show you with my elbow. So imagine that this is as far as I could actually actively get my elbow. But if I get my passive range, I could get my hand and actually push it all the way to here. This is too big a gap, obviously. So if this is my active range, what I would do then is I would get this hand and I would bring it up about 10 or 15 degrees past what here is my active range, 10 or 15 degrees past. I'd hold nice and still, and then I'll do my rep here. So I want to do a pales and then a rails contraction. So the pales contraction is the progressive angular isometric loading. So progressive just means the larger side of the angle. So this is the angle. As I'm doing this, this is getting larger, this is progressive, so progressive is pushing this way. Anyway, active range, passive range, hold still. So pales is me trying to straighten my elbow, but I'm not going to go anywhere because I'm holding still. So I'm doing everything I can to straighten it. And then once that's done, I'm going to pull back the other way, which is me trying to come this way. But I'm going to hold still. So here we go. So this is my active range. I then pull in 10 or 15 degrees. Now I do my contraction here. Take a big breath, brace, pushing away, pushing away, pushing away, pushing away, and then 10 seconds, and then once that 10 seconds is up, I come back the other way as hard as I can for 10 seconds. Once that rep is done, have a relax, come back another 10 or 15 degrees. Do another rep, another 10 or 15 degrees, and just keep going 10 or 15 degrees each time until you get right to the end of your passive range. So now I'll show you the setup for the hip internal rotation. So, hip internal rotation this is my left leg. I'm just going to do this against the wall, right? I like to do it against the wall. You can do it against like any kind of wall, corner, door frame, doesn't matter. Just sit here, get your internal rotation active range, get your foot there, and now you're at the end of your active range. To get another 10 or 15 degree stretch, all you've got to do is either move your body that way or rotate it this way. So I'm going to rotate it. So this is my active range. If I rotate my body here, keep this still, I've now gone about a 10 or 15 degrees more. So this will be where you do your first rep. So here, you're going to try super hard. So you're going to take a big breath, brace your core, and now you're going to do a pales contraction, which is rotating this way. You're trying to get it straight back to normal, but there's a bloody wall in the way. I can't go anywhere. I'm doing this. I'm going to do this for 10 seconds. 4, 3, 2, 1. Then reverse direction. Try to rotate more. Try to get that foot off. Do everything you can to get more rotation, more rotation, more rotation. 4, 3, 2, 1. And then relax. Woo. Once you're relaxed, now you're going to stretch another 10 or 15 degrees. I can't do this because I don't have hypermobility, but you'll be able to just stretch a little bit more, rotate a little bit more. So just go 10 or 15 degrees more, do another rep, then do another 10 or 15 degrees, do another rep, and just keep doing that until you get to the end of your passive range of motion. The same way I did with my elbow. I started here, went there, 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 there. So the bigger your gap, the more reps you're going to do. The smaller your gap, the less reps you're going to do. And that is your hip internal rotation, positional isometrics. Now, a couple things to keep in mind are intensity drives adaptation. The harder you try, this should be literally 100% effort stuff. You should be shaking from effort while you're doing this. But the first week or two, that's not what your program's going to show. Your program might show 50%, 40%, 60%, 70%. in your first week or two. Do what the program says, because we don't want to make sure, obviously, we're not hurting ourselves along the way. We're going to slowly increase the intensity. But once it gets to 100%, 100% is where it's at. So just keep an eye, be mindful of what it says there. But once again, I know this is a new sort of exercise, a new sensation that you're supposed to be feeling with your body. So if you've got any questions at all, make sure that you shoot me a message and fire away. Enjoy your new hips. All right, positional isometrics for hip internal rotation. First thing I'm going to do is explain what positional isometrics are and why we do them, right? So let's just say, I'll use my wrist as an example, right? So this is my active range, this is my passive range. There's about a 10 or 15 degree difference between that. And a rule of thumb, 10 to 15 degrees is right. Sometimes you'll have a joint where you've got a much bigger than 10 to 15 degree difference between your active and passive range. And what we use these positional isometrics for is to close that gap, because when that gap is too big, you've got too much of a range that you don't have control over. Your nervous system then gets a bit worried about that, creates tightness, creates pain, that type of thing. So when you use the wrist as an example as well, again, imagine that 90 degrees is what I can passively get to, but I can only actively get to 45 degrees. So this is my active range, but then I can passively push it down. That's too big a range to not have control over, but that I can actually get into. So what I would actually do is I would get to the end of my active range, pull it down about 10 or 15 degrees, hold still, and then create tension at this point. So that's literally what we're going to be doing with your hip internal rotation. I'm going to give you two options for this. Find whichever one use whichever one you find the most comfortable. So we're going to do, first of all, in a 90-90 position. We're going to get into the 90-90 position, and we're going to do internal rotation of this back leg. So as I rotate this way, if I lift my foot up so I can rotate internally, I'm now within active range. As I rotate my hips back towards this back leg, I now can't get it off. If I come a little bit further, I can. So this now is the end of my active range. I can continue to rotate my hips back, but now I can't go back any further. So now I've got to the end of my passive range. For me, that's about 10 or 15 degrees. For you, what I want you to do is find the end of your active range. So now I can't lift up. If I move forward, I can. So find the end of that active range, and then just push the hips back about 10 or 15 degrees and stop there. This is where you're going to be doing your work. At this point, you're going to stay nice and still. Brace your core, don't let anything move. And you're going to do a pales contraction and then a rails contraction. So pales is going to be pushing the ankle into the floor. So you're trying to rotate the leg that way. Obviously it won't move because there's a floor in the way. So you're going to drive down. So you're going to brace your core, and you're going to drive down at whatever the prescribed time is in your program. It'll either be probably 30 seconds or 15 seconds, depending on the intensity. So assuming we're doing, say, 30 seconds, I want you to hold nice and still, use your hands on the floor, and then start driving that foot into the floor. Just gradually build up 10, 20%, 30, 40, 50, 60%. So now I'm just driving down here at about 60% effort, but I'm trying to rotate my leg. So you're going to do that for 30 seconds. Once that 30 seconds is up, and I'm still pushing down at the moment, you're going to try to reverse direction. So you're going to use everything on the hip here to try to lift this foot off. So once again, you're trying to rotate the hip this way, or the leg that way in the hip. So you're lifting up. Once again, it won't move because you're past your active range, and that's okay. So it's 30 seconds down, 30 seconds up. Once that's done, chill, relax. When you feel like you're ready to do another set, do it. So that might take 20 seconds, it might take 2 minutes to relax and feel like you've recovered enough to do another rep. So that's the 90-90 version. And now we're going to do what's called a bear sit version. So this is a bear sit. So you literally sit, legs up, shins at about parallel. So to get to internal rotation, I'll do my right leg again. To internal rotation, all I do is I use my hip to come in. So that's the end of my active range. I can now push a little bit further. That's my passive range. Make sure that as I do this, your whole hip doesn't, so make sure that your hips stay on the floor, active, passive. Same thing, there's only about a 10 or 15 degree difference for me, but for you, you would be able to push more than that, probably 10 to 15 degrees. You're probably getting 20, 25 degrees. So get to the end of your active range, and then just push it down about 10 or 15 degrees. Hold still, and then what you're going to do is, for your first rail, your pails, your first one is you're going to push against your hand. So you'll be using everything on the outside of the hip to pull against the hand for 30 seconds, and then drive this way for another 30 seconds, trying to pull a little bit more that way. Once that 30 seconds is up each way, hold still, rest, recover, and go again. So that's your positional isometrics. Find the end of your active range, push about 10 or 15 degrees, hold still, 30 seconds pails, 30 seconds rails. As your program progresses, you'll be getting up to sort of 15 seconds at 100%. Good luck, have fun. If you have any questions, please obviously let me know.